Welcome to this Tuesday's topic on IBS, Irritable Bowel Syndrome. I am Ashley Anderson, registered dietitian, personal trainer, and owner of Move Fully Nourished, where we specialize in nutrition and exercise coaching using an integrative approach to help active adults achieve their optimal health, healing their mind, their body, and their spirit. Our integrative approach is designed to empower you as well as transform your lifestyle and relationship with food forever. So irritable bowel syndrome, this is a common disorder of the large intestine. IBS causes stomach pain and irregular bowel movements. And if you've been given this diagnosis, you know that, you maybe you've been told by your doctor, you have to live with it for the rest of your life. Well, I'm here to tell you that you do not have to live in pain with abdominal cramping, diarrhea, constipation, bloating, extreme fatigue, food sensitivities, anxiety, depression, and excessive gas. At Move Fully Nourished, we help our clients get to the root cause of their IBS. By assessing their gut health with a stool sample, we design individualized protocols for healing their gut, and we get rid of symptoms permanently. There are 4 types of IBS. There's IBS-D, which is IBS with increased instances of diarrhea. There's IBS-C, which is with increased instances of constipation. IBS-M is when you have kind of frequency between diarrhea and constipation. And then IBS-U is unclassified. It's kind of when your symptoms don't really fit into one of the other categories. The data that's available from more regional studies has shown us that the prevalence of IBS is increasing across many countries, 10 to 15% in Europe and North America, range of about 22% across countries in Asia Pacific region, and the highest prevalence really from ages 15 to 65, and especially among young adults 18 and up. What is even more crazy is that people don't seek help until they're in their 30s or even when they're 50. And this is a crazy long time to live with it and not address it when your quality of life could be completely different when addressed appropriately. So when we take an integrative and functional approach to finding the solution for our one-on-one clients, we first assess what are our clients eating, because diets high in inflammatory fats, processed carbohydrates, milk or dairy products, spicy foods, alcohol, and coffee all exacerbate IBS symptoms. Gluten also has been shown to be a main offender with IBS. So we also need to not just assess food, but cognitive and emotional factors, because stress is a common trigger for these individuals. We then assess the gut microbiome by testing a stool sample to really gain insight into what types of bacteria are present or not, and then that should be. And if there is a parasite or fungus or infection present, the types of fibers that are present in the stool or not. And this is about a 50-page report of data so that we can create a personalized protocol for each person. And many individuals who present with IBS symptoms benefit from a low FODMAP diet. FODMAP stands for fermentable oligosaccharide, disaccharides, monosaccharides, and polyols, which really helps those who can't digest fructose coming from fruits or processed carbohydrates, or those who have lactose malabsorption from dairy products. The low FODMAP diet is a strategic elimination diet that's used temporarily while the gut is healing, with also a supplement protocol. And then foods are reintroduced one at a time to assess the acceptance from the digestive system. The use of probiotics also plays an important role in improving IBS symptoms through manipulation of the gut microbiota. It's a very step-by-step process, and the approach takes time, but the outcome of the process is so rewarding, because imagine just going out with friends and not feeling the anxiety of needing to know where the nearest bathroom is located, or the ability to just live quote unquote normally without spending the day in the bathroom or hunched over in pain. A life without pain, gas, bloating, digestive discomfort, and improved energy and overall happiness can be the life you lead if you're currently experiencing these symptoms. Other important factors for individuals with IBS is movement. In 2018, there was a study of about 600 people with IBS, and they suggested that exercise interventions like yoga, walking, aerobic activity, mountaineering, qigong, they all had significant benefits for patients with IBS. And those who were inactive were about 3.5 more times likely to suffer from IBS. So also addressing your stress is a very important part of the solution. Anxiety plays a major role in GI functioning due to the communication between the gut and the brain. What we think impacts how we digest food. Cognitive behavior therapy has also been found to be one of the most effective behavior therapies in this brain gut domain, with techniques that enhance the person's ability to downregulate pain pathways and reduce avoidance or isolation associated with symptoms. Other techniques to help reduce anxiety and stress could include diaphragmatic breathing, heart rate variability biofeedback, progressive muscle relaxation, guided imagery, and mindfulness-based stress reduction. So the 4 steps that we at Move Fully Nourished take to help our clients heal their IBS is: first, we need to holistically assess our client's lifestyle. What are they eating? How do they live? How much sleep do they get? How stressed are they? If they have allergies, or if they've succumbed to antibiotics overuse. We look at food sensitivities. We test for the presence of yeast, bacteria, parasites. We talk about hormonal imbalance, vitamin D status, thyroid function, and exercise regimens. And we also need to know what types of medications that they are currently on or have been taking or prescribed. We need all the pieces of the existing puzzle to see the whole picture to individualize the plan. The second thing is we need to help our clients get started on a low FODMAP diet and really help each person navigate through taste preferences, aiming to include as much variety as possible on a limited menu. Because a low FODMAP diet, you're eliminating wheat, rye, dairy, beans, lentils, garlic, onions, asparagus, cauliflower, Brussels sprouts, mushrooms, fruits, sugar, and sugar alcohols, among other things. But it's not meant to be a long-term diet. This is temporary. It's temporarily providing relief as we incorporate lifestyle and supplement modifications, and then we reintroduce foods later. The third step is to make those lifestyle modifications. So we work with our clients to reduce stress. We outsource to other professionals and counselors when appropriate, and develop daily relaxation techniques as a part of a regular exercise routine. And we also discuss periods of resting the gut between meals and slowing down your meals, as rushing the process is very stressful to your digestive tract. The last thing, we use gut healing supplements and then it's necessary in the healing process, because we need to improve your gut bacteria diversity and decrease your pain, fiber. We need to increase beneficial bacteria, decrease constipation, kill infections, eliminate parasites, and ultimately improve your quality of life. So if you or someone you know is dealing with IBS and has not found their forever solution, it's time to ask for help. Reach out and apply for our one-on-one coaching program. You can find us at movefullynourished.com. Click on apply now and fill out our short application to schedule a complimentary call to learn more. Because just because that you and your doctor has told you to live with it doesn't mean that you should. It's time to make a change and take control of your health today so that you can live a better life tomorrow. Thanks so much for listening to this presentation all the way to the end. Let me know if you have any questions. Have a fantastic rest of your day. Make it a good one.